Good evening.
Buenas noches. Son las 19:01
It is
del lunes
7
11 de
p.m.
mayo.
with 1 minute,
Estoy consciente que
Wednesday,
ayer dije que era domingo
May
20 de mayo
11th.
cuando era domingo 10 de mayo.
I know I
Día de las
said
Madres.
yesterday I said
Hoy
it
es
was
lunes 11 de
Sunday
mayo de 2020 y
10th.
estamos en el Palacio
I
Nacional
made a
en la
mistake
Ciudad de
about the
México
dates recently, but
y vamos a empezar la
today is
conferencia
Monday
de
11th,
prensa
and that
diaria
is what
sobre la
matters.
situación de
Let's
la
begin with
pandemia de
the
COVID,
daily
enfermedad
conference
causada por el
regarding
nuevo
the
coronavirus
COVID pandemic, which is a
SARS-CoV-2.
disease caused by the new
Hoy nos vamos
coronavirus
a centrar,
SARS-CoV-2.
como la mayoría de los lunes,
Today
en
we'll
el
be
informe técnico, tanto los
focusing
componentes
on the
diarios
daily
y
technical
algunos
report,
componentes semanales, incluyendo uno
including
que estará
some
pendiente,
weekly
que es la
components,
afectación por COVID en personal de salud.
such
Hoy
as
lo vamos a
the
comentar.
impact of COVID in
Y le
health
cedo al doctor
workers.
Alamía si empieza con el informe
So
técnico.
let's begin with it.
Con su permiso,
Dr.
señor
Alamia, you
presidente.
have the floor now.
Muy buenas tardes con todas, con todos.
Good evening, everyone.
Hoy día es el día 50. Ya
Today is day
recordamos
number
el
50
de sana distancia.
of the
Hoy
National
estamos en nuestra conferencia
National Safe
matutina
Distance
número
campaign.
73. Y bueno, como
This is
todas
conference number
las noches, vamos a
73.
iniciar con el componente de actualizar
Let's
el
begin
panorama epidemiológico,
with
tanto en el
the
campo
international
internacional, que es el menor, así
context,
como el campo
as
nacional, que es el
usual.
de mayor interés. En la siguiente diapositiva, precisamente, podremos ver
This slide we can see
cómo se ha estado comportando la pandemia a nivel
the
mundial.
development of
Si
the
vemos la cifra
pandemic
total de
worldwide. If
casos
we look at the
acumulados, pues bueno, estos acaban
total
de
number
los
of
4
cumulative
millones
cases,
de
we
casos
have
confirmados
over
en
4
todo el mundo.
million
Sin
confirmed
embargo,
cases
siempre hemos
worldwide
resaltado que la
now.
pandemia activa es ya del 29%,
But
menos de
the
la tercera
active
parte
pandemic
realmente
is
son los
merely
casos
29% of
que se
this
están
total
presentando
number.
como un componente activo de esta pandemia. Y estos casos confirmados en los últimos 14 días,
In these
además
cases,
tenemos
the
la
active
información
pandemic,
en función
remember,
de
is
la región de la OMS en la cual se
is
encuentra la
formed
población
by
afectada.
those
Vemos que
is
la región de los
constituted by those
Americas
cases that have been showing
continúa y
symptoms during the
seguirá
past
siendo la
14
región
days.
más afectada, dado que los países que la componen fueron
The
los últimos en
Americas is
entrar
the region
a
that
la
continues
pandemia
to
como
be
tal.
with
Y vemos cómo hay una reducción
the
interesante en
highest
la proporción
overrepresentation in
de
this
casos en las
chart with
Américas, 49.7,
49.7%.
cuando ya nos habíamos estado acercando a ser el 52%. Pero bueno,
With
vamos a ver esto realmente
We've
cómo se sigue
seen a
comportando
small
durante la
decrease
semana.
in our
La
percentage
siguiente diapositiva, por favor.
because we were reaching
La
52%,
actualización de los
but
números del día de hoy.
we'll continue to see how this develops.
36.327 los casos
Up
confirmados
to this day, we have
acumulados desde el inicio de la pandemia en el
36,327
país. Pero igualmente
total
tenemos la
confirmed
cifra
cases in our
de lo que
country
se
since the
consideraría
pandemic started.
la epidemia realmente activa en México,
But we also have the number of active
continúa
cases,
generando y dando
which are the
movimiento,
ones who
distribución y
continue
dispersión
to spread the
a
disease
la
around and
epidemia como
continue
tal, que
to
son
be a
los
source of infection. And
8.288 casos que se han
this number
confirmado
is
que han iniciado síntomas
8,288
en las últimas 2
active
semanas.
cases in Mexico.
3.573 las lamentables defunciones que han ocurrido a causa de esta
We've
enfermedad,
had
recordando que es una enfermedad
3,573 unfortunate
complicaciones
fatalities.
sobre todo
Remember,
enfocadas a
COVID is a disease that
la
can
función
lead
pulmonar
to
en sí,
severe
y que
complications,
también se encuentran
especially
bastante bien identificados
around the area of
los
the
grupos de
lungs.
riesgo, que son los que más se afectan precisamente con
And
esta
remember also that we've
epidemia,
been
y
talking
que el
about
doctor López Gatell
certain
los va a mencionar
vulnerable
en la
populations that are at
actualización
higher
semanal
risk
para que
of
veamos cómo
developing complications
continúa este
should they
comportamiento.
be infected with
Son más
COVID.
de 135,000 las personas que en México ya han sido estudiadas
We've
y que han
tested
ingresado
over
en casos
130,000 people.
sospechosos. En la
Over,
siguiente
over,
diapositiva
over
tenemos
135,000 people, actually.
327 casos que se han acumulado. ¿Cómo
Here
están
we have the
distribuidos
distribution
a
of
nivel
the burden
nacional?
of disease
Ya son solo
nationwide.
prácticamente 4 los estados
We
que
only have
todavía no han
4
cruzado
states
la barrera de los
left, meaning we only have 4
casos, pero
states
de
that
seguro en los siguientes
haven't
días
surpassed the
actuarán
100
y
case
empezamos a ver
barrier,
ya
but they
cómo
will
se empieza a
probably
pintar un
surpass
poco
it
más las
fairly
entidades
soon.
federativas con este color
And
más
we see
oscuro
most of the
que
states
representa
in
y
our
está
country are
prácticamente
now
ya por encima de los 1,000
represented
casos.
in
Si lo
some
vemos
shade
en la
of
siguiente diapositiva,
orange or
precisamente
even
aquí
dark
podemos ver
red,
en las barras
meaning they have
de
a
casos
higher
acumulados
concentration
todas aquellas entidades a partir de Quintana
of the
Roo
disease.
hacia la izquierda
Here we have the
que ya
same
tienen
information
más de 1,000
presented as a
casos
bar
en
graph,
conteo de carga
and you can
acumulada.
take a look at the
En la siguiente
total numbers
diapositiva
per state.
vamos a ver la epidemia activa en
Mexico
México.
City
Aquí
leading
sí,
the way,
los
of
colores
course.
no son
as well as the state of Mexico. Here we have the map distribution for the active pandemic, for the active cases in our country, and we see the color scale shows no variation regarding the map that we just showed. Here we have the same information presented as a bar graph, so you can have a better visual appreciation of the total number of active cases per state and what is the relation between them. Here we have the cumulative incidence rate distribution per state. And remember, the darker shades of green account for higher incidence rates, and lighter shades account for lower incidence rates. Remember, the incidence rate is calculated on the basis of the population, and it represents the number of confirmed active cases per 100,000 inhabitants per state. Here we have the comparison between the states. Mexico City has the highest incidence rate so far. Here we have the fatality distribution per state. And remember, we have 3,573 fatalities so far that have been confirmed to be caused by some sort of in some way by SARS-CoV-2, and we also have 259 fatalities that are currently catalogued as suspect fatalities. We are still waiting for the test results to come out. They might become part of the confirmed fatality statistic, or they might not, depending on the results. Here we have the fatality distribution per state, and of course those states that have at least a fraction of the bar represented in yellow still have some suspect fatalities that could be confirmed during the upcoming days as COVID-19 caused. Here we have the distribution of the cumulative confirmed cases per date of registration, and also the suspect cases that appear represented in yellow. Here we have the general pandemic curve, which is the cumulative burden of disease in our country. We've had 1,305 new cases in the last 24 hours. This is only over 3% increase. But remember, today is Monday, and during the weekend we see a decrease in the demand for medical attention. So tomorrow and on Wednesday we might be experiencing a slight increase. We'll have to wait and see. Now let's take a look at the hospital bed occupancy rates nationwide. This is data that was validated yesterday at 11 p.m. with 59 minutes, so close to midnight. We have across the country a total of 13,529 hospital beds that are equipped and that are able to provide care for patients with some sort of acute respiratory illness, out of which 7,057 beds are currently being used. So we have a 34% occupancy rate.
32%, pero casi en la última semana se ha mantenido la de hospitalización general en ese
So
porcentaje.
we've had similar
94%,
numbers, similar occupancy rates
estable, 94,
across the country
96,
during the past
95.
week,
Por lo
as
tanto,
well
tenemos
as similar
buenos datos,
notification rates.
bastante información. En la siguiente diapositiva veremos ese 34%, cómo está distribuido a nivel
Now we
nacional.
can take a look at this 34%,
En los últimos
how
días,
that is
ocupación en la
distributed
Ciudad de México,
nationwide.
el Estado de México, que son los que en su
Some
momento
states
tienen
have higher
mayor ocupación.
occupancy rates, some
En el
states
momento,
have lower
recordando siempre que esta
occupancy rates.
puede disminuir si hay egresos hospitalarios, es decir, personas que se recuperan y pueden darse de alta.
And remember, we are constantly monitoring the number of patients that are being admitted at hospitals, the number of patients that are being discharged at hospitals, and depending on this information, the availability or the occupancy rates can go up or go down. Finally, we can take a look specifically at the ICU beds occupancy rate across the country. Remember, these ICU beds are all equipped with a mechanic ventilator to assist the breathing process of the intensive care unit patients. Mexico City has a 64% occupancy rate, closely followed by the state of Mexico that stands with a 52% occupancy rate. Then we also have states as Sinaloa and Quintana Roo that have important occupancy rates as well. That would be my information for today.
Gracias, doctora Lomía. Vamos a proceder entonces ahora con alguna de la información semanal.
Thank you, Dr. Alomia. Let's start presenting some of the weekly updates. Remember, this information is not presented every day because it doesn't show great variation from day to day, but it is important to present it every now and then, so we do it weekly. This is the cumulative case curve and its distribution by gender, by sex, and by age group. It hasn't changed a lot. 58% of the confirmed cases are men, 52% are women, and most patients are adults. Here we have the comorbidity information for the fatalities. So out of all of the fatalities, which are the pre-existing conditions that all of these patients had in common and that pose a greater risk for presenting complications when infected with COVID. So the leading three causes continue to be high blood pressure, diabetes, and obesity. Then we also have smoking, which remember is very bad for your health and has a severe impact on the respiratory system. And smoking is 9.2% rate. So 9.2% of the fatalities have been smokers. We also have kidney failure, cardiovascular disease, that is a sort of an umbrella term for a variety of diseases. We also have cancer or the engagement in chemotherapy to fight cancer as important comorbidity conditions. Oh, and the first, so at the very beginning we showed the the sex distribution and the age group distribution for the cumulative confirmed cases. Now we are showing the fatality distribution per sex and per age group. And we can see some variation here. We see 69% of the total number of fatalities are men, 31% are women, and we can observe a pattern that we have talked about before, that is the consequence of the huge prevalence of chronic conditions in our country, which leads to rather or relatively younger populations being represented, the fatality distribution being overrepresented. This is also an important statistic, which is the fatality rate and its distribution according to the clinical symptoms, the clinical condition of the patients. So here we can get an idea of how the condition can affect the possibility or the probability of having a fatal outcome. So we are divided as, first one is outpatients, ambulatory infections, meaning people who have mild symptoms, headaches, throat aches, coughing, fever, that are rather mild symptoms that do not necessarily require medical attention within a medical facility, and we usually ask these people to stay at home. They account for most of the confirmed cases, and we've had 344 people who have died while being outpatients, and the fatality rate is rather small, it's 1.6% if we compare it to the other fatality rates. Then we have the stable hospitalized patients, the severe hospitalized patients, the intubated hospitalized patients. Remember, the intubated hospitalized patients are the ones in severe condition, in very critical condition. And as you can see, we see an increase in the case fatality rate across the different categories, from 1.6 to 15 to 21, and then 56. The average case fatality rate is 9.8, but with the exception of severe condition hospitalized cases and stable cases, and critical cases. Remember, we have a concentration. So remember, for the severe condition hospitalized cases and the critical condition hospitalized cases, all of them are registered into the statistic. But for the stable hospitalized patients and the outpatients, we have an underestimation of cases. So we are registering less cases than the ones that potentially are out there. But the important thing is the people who are at higher risk levels of presenting complications are all being provided with treatments and are being kept track of. Here we have the positive result ratio, or the positive result rate that we've talked about before, meaning out of all those people who are tested because they are cataloged at some point as suspect cases, how many of them turn out to be positive? And remember, they are cataloged as suspect cases originally because they show symptoms of either COVID or even respiratory complications, such as shortness of breath or the clinical diagnosis of pneumonia.
que tienen enfermedad ambulatoria.
So here we have the percentages
hospitalizados estables,
for
hospitalizados
the
graves,
clinical
o
state
intubados.
of different
Ahí está el
patients.
número de casos,
So
las muestras que fueron procesadas para cada uno de estos
if we look at the chart that is at the bottom, we see different categories: outpatients, stable patients, severe condition patients, and intubated patients. We see the number of cases, we see the number of tested patients, and we see the number of tests that came out positive, or the percentage of cases that came out positive.
En las curvas, lo que presentamos es de manera periódica cómo
And
se ha ido manifestando.
by observing these curves, we can see the development of these positive result rates throughout time. And we start at week number 9 because we started running COVID-19 tests before we had the first confirmed case. But because we didn't have any before week number 9, then the probability of it, or the percentage of people who came out positive, was 0. So then we had a very fast increase in positivity rates because we had very few cases, and then the number sort of stabilized, and it has maintained its stability so far. Now let's talk about the curves. This is the main monitoring element for phase 3. During phase 3, we want to monitor how the pandemic is manifesting within the population, how is it affecting the hospital occupancy rate, and how is it affecting clinics and other medical units. One of the elements of this monitoring system is the daily occupancy rate report, and also another important element are these projections that have been elaborated and had been designed by our teams of mathematicians and data scientists that come from National Autonomous University and from different higher education institutions. So let's remember what's the meaning of these curves. The curves represent the projection of what could happen during the taking into account all the measures, the massive mitigation measures, what are the different scenarios that could take place during the dates that are yet to come. So we see how the lower line, the lower dotted line, represents
de que los casos
registrados
en la fecha correspondiente alcanzaran esa cantidad.
The lower dotted line is a 10% probability. So we have different scenarios, right? So of course the lower dotted line is the best case scenario. Then we have a different scenario, and then we have another scenario. So the upper line, it's a 90% probability to get there. This is a normal way of analyzing different phenomena, including phenomena from the economic sphere and natural phenomena and other stuff and other different domains. We also have in this curve the peak of the curve, and we, according to the projection, we had established that for Mexico City, May the 8th, for the metropolitan area of the Valley of Mexico, which covers parts of Mexico City and parts of the state of Mexico, but they are considered one single transmission area. And for this area, the projection was that May the 8th we would have the peak of the curve. and after that we would start observing a gradual decrease in the curve. And the bars that appear in pink, in reddish, that's the actual cases that have been reported so far. So here we can see how there is a relation between the projection and what is actually happening. Also remember that there is a certain delay in the updating of the data. This is just normal. This happens all over the world. So we don't consider as points of reference the last 5 to 7 days. So for the interpretation, we always wait at least 5 or 7 days to have a better interpretation, because otherwise we would always think, we would always be under the impression that the curve is going down. This is same for COVID, for influenza, and now for malaria as well. So basically this is it. And that's the date, that's today's date, May 11th. Let's see other areas of the country and the same way of interpreting them. I won't be going into any further detail. This is the projection for the Valley of Mexico, same region, but taking into account the suspect cases. We've talked about how the suspect cases are the ones that show symptoms and are tested for COVID and are eventually confirmed or denied as COVID-infected patients. So what we see is that the different scenarios and the projections are designed having the number of confirmed cases as reference, but we also can use this pattern to have a visual comparison on the suspect cases. And we can do this because the patterns for the suspect case curve is similar to the pattern for the confirmed case curve. Now we have the confirmed case curve, and I will be presenting it like that: confirmed and suspect. Well, the second chart was the total, it was the addition of confirmed and suspect cases, but right now we're looking at the suspect case, no sorry, we're looking right now at the confirmed case curve for the region of Villahermosa, which is a city in Tabasco, in the state of Tabasco. The projection said that the peak happened a few days earlier, and we can see how indeed the curve, the tendency of the curve is now downward. So we can safely say that the area of Tabasco is now slowly coming out of the pandemic. We have Quintana Roo, the Cancun city area. We have confirmed case curve. We have the peak according to the projection. And then we see how the cases actually followed the curve, followed the projection, and they are now going down. And this pattern is the same even if we don't take into account the last 5 to 7 days. This is the chart for Culiacán, Sinaloa, same thing. And we see how the projection and what happened in reality are aligned well. Here we have the chart for the confirmed cases plus the suspect cases. And sometimes when we see a bar like this one that is abnormally short, it talks about an error, an human error in the reporting on certain cases. So sometimes we have to use the complementary information, which is the distribution per date of the beginning of the symptoms. So always taking into account that there is a certain period of time between the moment the person starts developing symptoms and then the time the test is being done, and then the time that the test results are actually the test results come out. So sometimes we have to adjust the information because the way of distributing the data changes according to the different dates that are used. So based on this analysis, we can sometimes infer some sort of delay in the presentation of the information. Now, for the region of Tijuana, we had the projection and we had the bars, but we are still not too sure about this trend because we still have to discount the last 5 to 7 days. So, here we have the confirmed cases plus the suspect cases, and there's also an important disparity between confirmed cases and confirmed cases plus suspect cases, and this could be due to delay in the notification of the cases. And that is today's date. I think those are it. One more. Oh, and we have the region of those states that are only entering the pandemic. So all of the ones that showed, they are coming out of the pandemic, with the exception of Mexico City, which is still at the peak. And then we have this information for the ones that are still entering the pandemic. We have a quite inaccurate projection for Tlaxcala because this is a quite abnormal projection for an epidemic disease. So each week, twice a week, we have updates on the projection, and sometimes the projection changes a little bit and the curve changes its shape. Here we have the same with the confirmed cases and the suspect cases. But what we cannot explain so far, and the mathematicians are having trouble explaining, is when we take into account two different cities as one single transmission rate. If we don't take into account the occurrence of the dispersed cases in the rural areas, then the projection doesn't quite add up. So sometimes we have some dispersion of different cases. Veracruz, we see a curve that Veracruz is only entering the pandemic. We're still not right there.
La siguiente. Cuando consideramos los casos sospechosos, queda ahí, es un retraso de la confirmación o de la
lag there because we're waiting on confirmations. But we can see that increasing pattern going on there.
Vean Oaxaca,
In
Oaxaca, lo que
Oaxaca,
les decía.
Oaxaca,
Es todavía una
this
predicción
was
muy
a very
inexacta
inexact
porque
prediction
vemos esta dispersión
because we
y
were
con
thinking
tan
about
pocos casos que han
dispersion,
ocurrido
but with
en un
the
calendario
few
todavía
cases that have
muy
happened and that have
esporádico,
been
no se puede
reported
hacer una
on,
predicción
it's been
que
quite
converja a una
sporadic, so
curva
we
única.
can't really
Hay
predict
dispersión
there.
territorial
We have
y
a
hay
lot of
dispersión en el
dispersion
tiempo.
in the
La
territory
siguiente.
and in time.
Lo
Same
mismo cuando
when
agregamos los
we add
casos
up the suspect
sospechosos, además
cases
de los
besides the
confirmados. Y
confirmed
cuando vemos la
cases.
curva, que no
We
la
can take a look at
tengo
that
a la mano en
curve.
este
I don't have the
momento,
information
de
on hand right
ocupación
now,
de
but the
hospitalización,
occupancy
vemos
rate
aún
we can
menor
see
exactitud en
is
la
a little
predicción
bit
porque
under the
tenemos
prediction
aquí en la terapia
because we have
intensiva
here
varios
a
casos
number
que no
of
están
cases
considerados
in
en la
the
predicción. La
ICU that
explicación es
weren't
esta:
considered in the
no se
prediction.
están integrando los
Some
casos
of
que
the
ocurren
cases that are
esporádicamente en
just
el territorio
sporadically
fuera de las
distributed
zonas
around
urbanas, que son
urban
sobre las que se hace la
areas are not
predicción. La
included in the
pregunta obvia sería,
prediction.
bueno, ¿y por qué
And
no los
so the
incluyen en la
obvious
predicción?
comment is,
Porque
well, why
entonces
don't
lo que
you
nos lleva
include
es
those in the
a una
prediction?
predicción que es
Well, that's
demasiado
because
vaga
it just
respecto
makes
al
a very
territorio.
vague prediction with
Aquí lo
respect
que
to
interesa es
the
encontrar un
area
balance
of the
entre
territory.
predecir lo que va a ocurrir
We
en una
want
zona
to be
donde se
able
está
to
haciendo la
predict what is
intervención
going to
principal,
happen
que
in
es
an area
garantizar
where we
la
are
disponibilidad
taking
hospitalaria,
actions
versus tener una predicción
versus
que no
predictions that
converge en
don't
el
really
tiempo.
converge in
Entonces,
time.
ambos elementos pueden
Both
ser
elements can be
informativos, pero
informative,
para fines
but
de la fase
for
3,
what we need
nuestro
for
énfasis
phase
es la
3 is we
ocupación
really want to know
hospitalaria.
about occupancy
Gracias.
rates at hospitals. Thank you.
La siguiente, Cuernavaca, Morelos. En
Next,
Cuernavaca, Morelos tenemos
Cuernavaca,
en la zona
Morelos.
del ACME,
In
en la
Cuernavaca,
siguiente, cuando
we
adicionamos
can see the
los casos
prediction here and
sospechosos,
it converges pretty
acercamos al
well.
ACME
It's
para
descriptive.
que
It
llegue
describes
finalmente
the
la fase de
tendency that
descenso.
is following along with the number
Creo que
of
esta es la
cases.
penúltima.
And
Siguiente.
we
Acapulco,
saw
Guerrero.
that basically
Acapulco,
today
Guerrero.
we were at the
Tenemos hoy
acme of
predicciones
this
para
curve.
47 ciudades.
When we take a look
Y
at the
nuestros
suspect
colegas,
cases, we
los
see that with
expertos
respect to the
matemáticos,
previous
nos están
slide,
ayudando a
we
hacer
can see the
predicciones para
cases that we're
distintas
still waiting to
regiones,
hear on
ciudades. Se
confirmation. So
empezó
we
con
still
una
have to
predicción
wait to get to
para
that
las
peak
ciudades que
moment.
tuvieran más de
But then we
800,000
will know
habitantes
about
o que tuvieran
the
una
downturn
intensidad
that
de
is coming after
transmisión
that.
alta.
Oh, Acapulco,
Después
Guerrero.
han ido bajando y tenemos hoy,
Today
por
we
ejemplo, en
have
el caso de Guanajuato,
predictions.
para 6
They
ciudades.
are for
Para el
47
caso de Guerrero
cities.
tenemos 2 ciudades.
Our
Aquí por ánimo de tiempo
colleagues
presento las que son
who
más
are
representativas.
expert
Pero estas predicciones las tenemos
mathematicians,
para
and they're
varias
helping
otras
us
ciudades de
create
interés.
predictions for different
Aquí
cities
vemos
and areas.
Acapulco, Guerrero,
We started with the
menos
prediction
convergencia, es
for
una curva
cities that
más
had more than
extensa, pero
800,000
todavía bastante cercana a lo
inhabitants
que
because they have
finalmente
a
está ocurriendo.
strong
Si agregamos
probability
los
of a high
casos
level of transmission.
sospechosos,
But
vemos esto.
for the
Y
case of
aquí
Guerrero, we
también
have two
existe la
cities
inquietud
here. I
de dos
am going
cosas.
to
Una,
give you
el
just the
porcentaje de
ones
confirmación,
that we have
que podría
time
ser
to see and
menor
what cities are more of interest to us
localmente,
at this
de hecho
point.
es menor
In
localmente,
Acapulco,
y lo
Guerrero, there's
segundo
less
es que hubiera
convergence.
retrasos en la
So I think it
notificación.
is
Eso lo
close
comparamos
though to
siempre
what
con
is
por
happening.
fecha de
And if
inicio de
we
los
add
síntomas,
on the
la curva
suspect
se extiende
cases
hacia el
to that,
pasado
we
y
can see
podemos ver
this.
una mayor convergencia.
We can
Aquí
see
tenemos
here
el
that
ACME
there is that
el 22 de
concern
mayo,
about
todavía
the
faltan varios
percentage of
días,
cases that are being
11
confirmed
días antes
because
de
it
que
might be
lleguemos a ese punto
fewer
ACME. La siguiente.
locally. I mean, it is fewer locally.
Guadalajara,
And then the
Jalisco.
second thing is that there are
Guadalajara,
lags
Jalisco tiene
in how we're getting
de manera
notified.
muy notoria pocos casos.
We have
Hasta
the
hace
beginning
una
of when
semana
symptoms were
la predicción era muy
presented,
extendida,
and
poco
then we can see how
precisa
that
y
factors
tenía
into
que ver
the
con
prediction.
lo poco
Here,
informativos que resultaban
the
los
peak of the
casos,
curve would
no
be
solo
on
por
May
escasos,
22nd,
sino
22nd,
principalmente
so we
por
still have more
dispersos.
time to get to the
Y
peak there.
estamos
Guadalajara, Jalisco.
pues esperanzados
Guadalajara,
de que esto
Jalisco
represente que hay un momento
is
de muy
quite
baja
notorious
transmisión,
for having
pero
very
que
few
en su
cases at
momento,
this point. A week
irremediablemente por ser
ago,
una
the
ciudad
prediction
grande,
was quite
podría
extended. It was
levantar
not
un pico
precise.
epidémico. Creo que
And that
tenemos
had to
también aquí la
do with
siguiente,
the
los
fact that we weren't
sospechosos.
getting very
Aquí
much
vemos con los
information
sospechosos es un
from them.
poquito más informativa.
And it was mainly
Todavía
because
para
the
el momento
cases were
ACME
so
es
dispersed, they're
13
so
de junio,
distributed.
entonces todavía falta
So we would like to see if there's a moment when the transmission rates are very low, but for being such a big city, it might have a peak pandemic point. Here we have the suspect cases. The suspect cases give us a little bit more information there, but right before we know about the peak, which we think will be June 13th. Basically, a month and 2 days is what we are waiting for to get to the peak in Guadalajara. Next slide, please. Monterrey, Nuevo León, something similar happened over there. This is a very vague prediction. These are the cases we have there. Let's see with the suspect cases. We can see this is getting closer to the prediction, but there are relatively few cases. And here's where it gets truncated, because we can't really make a larger prediction because basically we didn't have enough room on the slide, but basically it would be ending in the third week of August, which is when we would be waiting to see what would happen in Monterrey. So with respect to Monterrey and Guadalajara, I want to give the following warning. Remember that all of these curves are predictions following along with our safe distance national campaign. As we've spoken about over the last weeks, we have to talk about how we're going to exit our national strategy, which we had planned for May 30th to stop with our safe distance campaign. And if we stop this soft distance campaign, we're still not going to be stopping preventative measures or health safety measures, because it's not convenient for the country to have a generalized confinement policy when there's so much in how in each area of how quickly transmission is happening. So with the 5 cities that we started with, and then we saw 4 cities that were lower, that were going down in their transmission rates. Others have higher transmission rates, and some cities don't have transmission right now. So it's not really convenient for us to have a national safe distance campaign, but that doesn't mean that locally we won't be having that, because we want to make sure that we're keeping our transmission rates mitigated. Is that it? Oh, great, perfect, that's all. Oh, the doctors. Let's go quickly through our healthcare professionals. This is the information on our healthcare professionals. And no one wanted COVID to happen, but it's very worrisome. It affects us and worries us to know that our healthcare professionals, our doctors, social workers, nurses, and all the other people who are essential healthcare workers, and they're in hospital and clinical situations, and they are at such a high risk of getting COVID. And that's because they're at the highest area of concentration of sick people. So what happens with sick people who are critically ill, they have a greater ability to be able to propagate or expulse a viral particles that could infect people. Our clinical units, our hospitals are really areas that are high risk, and it's a high risk profession being a healthcare worker. We have 8,544 cumulative confirmed cases for healthcare professionals. And this is positively documented. They've been tested. We have 23,525 people who were tested, and they tested negative. Because they were tested because perhaps they had contact with people who had COVID, or perhaps they had suspicious symptoms. That was the majority of there. And then we have 6,747 cases that are still being tested. I'm not going to get down to the dirty details here, but you can see by state, according to color, exactly what is on the right-hand side, which is confirmed cases cases in red, suspect
De
cases
estas
in yellow, and negative cases in
2.147
green. Those
son
are
casos
people who
activos,
had
de los más de
symptoms but were
8.000,
negative for
2.147 son casos
SARS-CoV-2.
ocurridos en los
In
últimos
Mexico
14 días.
City
La
and
distribución por entidad federativa es semejante
Baja
a la de los
California and
casos
Quintana Roo,
acumulados.
you can
La
see there's
siguiente,
an occurrence pattern
la
going on here.
distribución por sexo y edad. En este caso tiene un predominio del sexo femenino y
Of these
representa mayormente personal de enfermería,
2,147, these are
pero
active
también hay
cases.
diversas
Of the more
médicas
than
y otro
8,000
personal
cases,
auxiliar de apoyo en
2,147 are
los
cases that have been
hospitales que ha
confirmed
tenido
over the
la
last 2
afectación.
weeks.
El espectro de edad es también a lo largo de todo el espectro de
Next,
edad y es
please.
semejante a la distribución de edad que
Distribution
existe de
by
los casos en
sex and
general
age.
fuera del personal
Here
de
you
salud.
can
La
see
siguiente.
that it's predominantly female,
Por
and
profesión
those
o
are
por ocupación concreta.
nurses
Ahí
for
están
the
nuestros
majority, but they're
compañeros
also
enfermeras y
doctors and
enfermeros,
other
representan
auxiliary support
41%
staff at
de los
hospitals who have been
8.544
affected.
personas
In terms
afectadas.
of
Médicas y
age,
médicos son
over
37%.
all the ages,
Otras
it's
profesiones
similar to the
diversas que
distribution of
incluyen
age for general
al personal
cases
de apoyo
for
en las
people who are
operaciones
not in
hospitalarias
hospitals
de
or aren't
diversas
healthcare professionals.
características
By
son
profession,
19%,
here you can
laboratoristas son
see
2%
our
y odontólogas y
nurses,
odontólogos son
they are
1%.
41% of the 8,544 people who
Cuando lo
have been
vemos por
affected.
institución,
Doctors,
esta es la distribución,
37%,
ustedes la pueden ver, no
and
entro en
other
ningún detalle,
healthcare
pero sí quiero
professionals,
hacer aquí una aclaración. En
19%.
las entidades
This includes
federativas en
support
particular,
staff
aunque también
for
ocurre en la Ciudad de México,
operations.
es un hecho común
That's
que un
19%.
miembro del personal de salud,
Laboratory
particularmente
workers,
las
2%,
médicas y
and
los médicos,
dentists,
aunque en algunos
1%.
casos también el personal de enfermería, laboran en más de una institución.
When we take
En
a
la
look
mañana
at
laboran en el IMSS, en la
this
tarde en el
information
ISSSTE,
by
el fin de semana en el
institution, I'm
Hospital
not going to go
Civil,
into
por ejemplo,
detail here. You
o
can take a
cualquier
look at
tipo
this, but
de
I would like
organización
to
que tengan.
clarify here.
Esto que
In
representa
the
que no
states, in
necesariamente la
particular, like
institución
in
por la que
Mexico
están
City, it's a
identificados
commonly
es la
known
institución
that
donde se
healthcare
infectaron.
professionals,
Ni tampoco debe
especially
interpretarse, quiero dejarlo muy
doctors,
claro,
although in
que es la
some
institución que
cases
representa
nurses,
el mayor riesgo
they work
laboral.
at more than
Es
one
sumamente
hospital.
difícil en cada
In the
uno de estos
morning, they
casos
work at
que han sido
Eames, in the
analizados,
afternoon in Eastay, and on the weekend
indicar
at the civil
exactamente dónde
hospital, just
pudieron
as an
haber sido
example.
infectados. Y
What
en
does
no
this
pocos
mean?
casos puede ser que además laboran
This
en
means
una
that
dependencia
not
privada,
just the
ya sea un
institution that is
consultorio o
identified
particularmente un
here, that
hospital,
doesn't mean
de
that's the
modo que
hospital
los estamos
they got. I want to be
trabajo
very clear
principal y
that
estamos asumiendo como principal el
we are
de la jornada
showing you
matutina
which institution
y así
represents
es
the
como están
highest risk.
organizados.
We have
La
to
siguiente.
indicate exactly where these people
Cuando lo
could
vemos
have been
por
infected. And in not few cases, we've seen that they work in private
distribución,
hospitals. Maybe it's a consultancy or a
afortunadamente, en
hospital.
este caso,
But
fíjense, esto es
here,
muy
what we're
ilustrativo,
showing you
aquí no
is
aplica
where
vigilancia centinela,
who is
estamos
infected, who works
documentando
at their
todos y
main
cada uno de
job.
los casos,
And we're also showing
también los
who is
leves.
infected on their
Y
morning
esto nos
shift
permite
or
tener
on
un
their evening
reconocimiento
shift.
de la distribución en
When we
términos de
take a
la
look at
probabilidad
the
de que ocurran como
distribution
casos
here, I
leves,
can tell you that
afortunadamente la enorme mayoría, casi
fortunately,
9 de
this is
cada
very
10
illustrative.
y 1 de
This
cada 10
sentinel
con
surveillance
enfermedad
doesn't
que
apply here.
requiere
Here we're
hospitalización. La
monitoring each
siguiente.
and every one of the cases, including cases
Las
that are not
condiciones de
critical or
riesgo o las
serious.
condiciones de
So here
enfermedad
you can see the
asociadas
distribution in
potencialmente
terms of
a la
probability
condición
for
de
non-serious
salud
cases, about
del
9
comportamiento del
of every
COVID
10
en los
or 1
casos
out of every 10
relevantes
if
están
it's a
aquí
disease that requires
obesidad,
hospitalization.
hipertensión, diabetes, tabaquismo. Asma aparece con mayor
The risk
frecuencia que en los
conditions,
casos en
these are
general
risk
o los casos
conditions
letales y las
associated
demás son
to
parecidas a las que hemos
health conditions
manifestado
for how
en líneas
COVID
generales.
has
La
behaved.
siguiente. Cuando lo vemos
Here
por entidad
is
federativa, es
obesity,
indudable que donde hay
hypertension,
más
diabetes,
población y
smoking,
también mayor
asthma.
operación en las unidades de
Asthma
salud, porque tenemos más
occurs
hospitales,
in
es
more
donde también
cases
tenemos más
than
casos,
usual that are
33
lethal
en
or
la Ciudad de
fatal.
México y
And then we have other
Tabasco, etcétera,
conditions
etcétera,
below.
etcétera. Estas son las 111
When we take a look at
defunciones.
this by
Muy,
state,
muy
there's no doubt
lamentablemente también hemos tenido
whenever there is a more
mortalidad
intense
en personal
population
de salud,
density with more
particularmente
hospitals,
quien
that's
tiene
where we have more
enfermedad
cases,
de inicio
33 in
grave.
Mexico City.
La siguiente.
And you can see Tabasco
Cuando
and all
vemos
the way
a
down.
estas
These are the
personas
111
representadas en forma de
deaths.
números,
These
en forma
very,
gráfica,
very
de
unfortunate
acuerdo a
deaths.
su grupo
We
de edad
have had
y
mortality
su
among
sexo.
healthcare
Vemos también
professionals,
el mismo
especially with
fenómeno
people who have a serious version of COVID from the start.
Personas adultas jóvenes que también
When
están en el
these
grupo de
people
mortalidad.
in the form of a bar graph,
Cuando vemos
we can
específicamente
take a
las
look at their
condiciones
sex
de
and
salud
age, and we see the
frecuentes
same
en las
phenomenon.
personas que han perdido la vida, podemos
We
ver
can see
las
that we have
mismas:
young
obesidad,
adults
hipertensión, diabetes, asma,
who
que
are
también aparece
also
aquí,
in the mortality
tabaquismo,
group.
inmunosupresión, enfermedad cardiovascular y enfermedad pulmonar obstructiva
When
crónica.
we specifically
La
take a look at
siguiente.
health
Y
conditions that
finalmente
are
tenemos,
frequent in
de
terms
acuerdo a
of
la
people
entidad
who have
federativa
lost their
y a la
lives, we see the
profesión, a la
same.
ocupación
We see the same
específica.
thing:
No me detengo en
obesity,
ningún detalle, pero pueden
hypertension,
ustedes tomar la
diabetes, asthma
fotografía.
is on
Son
here as well,
111
smoking,
personas que
immunosuppressive
lamentablemente perdieron la vida entre nuestros
diseases,
compañeras y
and
compañeros
cardiovascular
profesionales de la salud,
disease.
y tenemos esta
And
distribución
finally,
que
according
sigue
to
gruesamente
state
también la
and
frecuencia
according to
de,
the specific profession or
de la
occupation
cantidad
that this
de
person
personas,
has, you can
miembros del
take a
personal
picture
de
of this.
salud.
I'm not going to go into detail here.
Gracias.
These are 11
Vamos a
people
dedicar
who
los
have
minutos que
unfortunately
restan
died.
a preguntas y respuestas, por favor.
And
Vamos
these
a
are
dar
healthcare
paso a usted,
professionals, and you
Bianca,
can
y a
take a look at the
Vanessa.
distribution here. This also shows you the number of people who are healthcare professionals. Let's go to Q&A.
Miembros de la Alianza de los
Yes,
Trabajadores
you,
de la
Bianca,
Salud
and then
y
Hans Salazar.
Empleados Públicos.
Thank
Dijeron
you.
que,
Thank
bueno,
you.
pues ellos requieren medidas radicales esto para la
Thank
protección
you. Good evening,
del
Bianca
gremio, saber
Aguirre
si
from
pues se
Notimex
aplicarán estas
TV.
medidas ya que siguen a
Today
pesar
there were
pues de que
people
sabemos, ¿no?
outside,
Su
people
trabajo,
from
su
the
gran labor,
Workers
pues
Alliance,
siguen
the
las
Workers Health
agresiones
Alliance,
desafortunadamente
and
para este
public
gremio.
employees.
Y otra cosa, la
They
ONU
said that
teme que al
they
término
need
de la pandemia,
radical
obviamente
measures
cada país
for protecting
en
their
su tiempo y
union,
espacio,
because if
al
they
final,
apply
bueno,
these
pues haya
measures
en todos estos
and they
países que se han sufrido de
continue,
la pandemia 7
I
millones
mean, with
de
this
embarazos
great
no
work that
deseados.
they're doing, but
Esto
people are
debido a la
still
falta de
assaulting them.
anticonceptivos y también por
And
la
another
violencia que se
thing,
puede dar en esta
the
etapa. Y quiero saber, por
UN
favor, si México, bueno, pues está preparado para estos
the
embarazos.
UN
Muchas
has
gracias.
talked about how each country in its own way is dealing with this.
Respecto a medidas
And
de
with
protección,
the
entendí que
countries
era de
who
seguridad, la seguridad de la integridad
have
física
experienced the
de
pandemic,
las
we've seen that there have been
trabajadoras y
7
trabajadores de la
million
salud,
unplanned
pues definitivamente es algo que nos
pregnancies.
sigue preocupando.
So
Cuando
is
vimos al
Mexico
inicio,
prepared
estoy
for
hablando de
all
hace
those
unos
unplanned pregnancies because
8
people can't
semanas,
access
este patrón
contraceptives?
sostenido de incremento
In
en el
terms of
número de ataques
PPE
por semana
equipment, I understand
nos
it's about
preocupó porque
the
parecía un patrón
physical safety
de
of
ascenso rápido,
workers,
casi
healthcare
tan rápido
professionals.
como la curva
It's
epidémica.
something that we're
Y
very
desde
worried
luego, desde
about,
el
and we
inicio
continue to worry about it.
reprobamos y condenamos este
From the
tipo de actos.
beginning, I'm talking about
En
8
general, cuando
weeks ago,
hacia cualquier
we saw
persona,
this
pero en este caso en
sustained
particular,
pattern
estaba
of numbers
asociado
of
con la
cases going
condición
up,
de
up,
ser
up, up.
trabajadora o
And we
trabajador de la
saw
salud.
that this
Después se
pattern
estabilizó,
was
tuvimos
a
varias
rapid
intervenciones que aquí se han
ascension
comentado,
pattern that was
las que dependen de la
going,
Guardia
taking the shape of the
Nacional,
pandemic curve.
también la
And from the
seguridad en
very
torno a los
start, we have
hospitales, y luego
condemned assaults
recomendaciones
on
para la
healthcare
seguridad
professionals
de las personas,
against
y
anyone, but
apreciamos que hubo
particularly
un
in this
gesto o varios
situation,
gestos de solidaridad
those people who are
poblacional
being attacked
hacia los
because they are
trabajadores y
healthcare
trabajadores de la salud,
professionals. We
condenas
have taken
explícitas
actions, and we've
en
talked
redes
about that
sociales, en
here.
comunicados
We
públicos,
have the
etc.
National
En
Guard
algunas
on it,
entidades federativas se
and
optó
they're
por
working on safety for
establecer
hospitals, around
lineamientos de
hospitals.
penalización
And there was
para quien
also a
agrediera a
number
un
of
miembro del
gestures of
personal de salud.
solidarity
Y esto
from the
se
general population
disminuyó, pero desde luego
to
si sigue ocurriendo, se
healthcare
tiene que seguir
professionals
revisando quizá
condemning
caso por
assaults
caso
on
en las
these people.
entidades federativas,
In
a ver
some
si el marco
states,
legal
they
es un
opted
instrumento que nos
to
permitiera
establish
en algún momento
guidelines
disuadir
for penalizing
estas
people
agresiones,
who
que siempre
assaulted
son
healthcare
condenables y
professionals.
reprobables.
This
De los
is
embarazos,
we saw
como
there
dije
was a
ayer respecto al
downturn though,
Programa
but we see
Nacional de
that it is
Vacunación,
still
lo
going
mismo
on. We
aplica para
do
nuestro
have to
Programa
review
Nacional
this
de Salud
case by case
Reproductiva.
in each
Los
state
métodos de planificación
and
familiar y la
see if we
Consejería de
can
Planificación Familiar no
dissuade
ha
people
cesado
from
las
assaulting
actividades de
healthcare
atención de la
professionals
salud,
because this
incluidas las
is
preventivas.
terrible.
Desde luego
Oh,
son consideradas actividades
tendencies.
esenciales
Like I said
y
yesterday
están
about our national
operando
vaccination
normalmente
program, the
los
same thing
26,000
applies
unidades de
to
salud,
our national
incluyendo todos los
reproductive
centros de
health
salud.
campaign.
El programa nacional,
Family
a cargo de la doctora
planning
Carla Berdichevsky, directora
has
del
not
Centro
stopped.
Nacional de Salud Reproductiva
Health
y
activities,
Equidad de
including
Género,
preventive health
está operando,
measures,
está
are
supervisando
considered
lo que ocurre.
essential and are
Y
still
lo que
going
sí
on
vemos es un patrón de menor demanda de
at the
servicios de salud. Es
26,000 health
esperable, las personas se quedan en
locations
su
in our
casa y
country.
entonces no van
Now, the
consultas
director of the
de medicina
National
preventiva o
Center
de
for
salud
Reproductive
pública
Health
en
and
programas
also
que
for
son
gender
importantes.
equity,
Y esto efectivamente
she's
puede
still working on that and
inducir
seeing what
que
is
se pierda
happening.
la
What
efectividad
we've seen
poblacional
is that
de
there's
los
less
programas de
demand for
planificación
health
familiar
services.
y
It's
de salud sexual y
unfortunate because
reproductiva.
people stay at their
Acordé
houses
con la
and they don't go to
doctora Berchevsky que
consultations for
precisamente
preventive
en los
medicine or
siguientes
for
pocos
public
días
health,
vendrá ella
which are very
junto con
important
la
programs.
temporada de
And this,
mujeres
yes,
y otras
this
compañeras
does
que están
mean that we
involucradas en estos
lose
temas
the
para hablar
effectivity
del
of
asunto
these
de los
programs for
derechos
Planned
sexuales y
Parenthood,
reproductivos,
for
donde hay material
planning
preparado, hay
family planning
estrategias
in the
que están en
general
curso
population.
para tratar de nivelar
In the
este
next,
problema que
over the
está
next
enfrentando
few
el mundo entero.
days,
Entonces, la
her
segunda
as well
diputada. Muchas
as
gracias,
the
Blanca.
head
Hans
of
Salazar,
the
y si nos da
Women's
tiempo,
Institute
Blanca
and
Valdés.
other colleagues who are
Muchas
involved
gracias,
in
doctor.
this
Hans
are
Salazar,
going
Ciencia
to
Médica
speak
Nutricia,
about
Desarrollo Político y
reproductive and
Zócalo
sexual
Virtual.
rights and
Preguntarle,
what
doctor,
the
muy
strategies
puntualmente,
are
de
that
las
we have in course
USMER,
so that
perdón,
we can
de
try
las
and
475
work
del
on
modelo
this
Centinela que
problem
usted
that the
ya
whole world
ha
is
explicado en
facing. So
varias
next week
ocasiones
we'll talk
aquí.
about that.
Yo
Thank
quisiera
you, Bianca.
preguntarle en ese
Hans
enfoque,
Salazar.
¿cuál es el modelo metodológico?
Thank you,
Y si
Dr.
para la
Hans
perspectiva
Salazar
que tenemos de que va a ser
from Grupo
un tema
Politico.
más largo, el tema
I'd like to
de la
ask you,
epidemia, ¿usted
Doctor,
contempla
about
aumentar
USMER,
esto en un enfoque
the
metodológico? ¿Podría explicar otra vez el
476
modelo?
from the
Y
Sentinel surveillance model, which you've explained a number of
hidroxicloroquina,
times here.
que
I'd
es
like to
una
ask you
preocupación de
about
mucha
that
gente que
focus. What's your
padece de lupus y a propósito de la
methodological
pandemia ha habido
way
una escasez
that
al
you're going to
respecto.
deal with
Y en
this?
este marco
Because
de la situación,
do
¿usted
you
va
think that
también
this would
a
increase in
pedir,
a
a convocar para que los
methodological
maestros le
way? I
pregunten
don't need you
en
to
estos
explain
días
how it
a
works
propósito de
again,
lo que ha hecho con los
but
niños, con
could
las
you
mamás? ¿Y qué
explain the
opina del modelo
lack
sueco? Bueno, ya le
of
pregunté demasiado, pero si usted pudiera hacer una
hydrochloropine,
síntesis, le agradecería.
Con gusto, nos quedan 4 minutos, trataré de
that
ser lo
was the
más
drug that
sintético
is being
posible. Si no
used for
nos da tiempo de todo, pues seguimos
but there is
platicando
a
mañana.
shortage of this.
Respecto al modelo
Are
Centinela, a reserva
you
de que
going
mañana
to
tanto el doctor Alomía como un
ask
servidor
or
podamos
make an
explicar más detalles?
appeal for
Básicamente,
people
como lo comentamos efectivamente en
to
varias ocasiones,
see what
durante
we
la
can do
fase
about
2
mothers and
fue el modelo
children? I've
útil,
asked
porque
a
nos
lot of
interesaba tener un
questions here, but if you could
reconocimiento
just do a
territorial
synthesis, that would
de
be
la
great.
ocurrencia de
We have
enfermedad.
4
Durante
minutes,
la
so I
fase
will
3,
try to
como lo anticipamos desde
synthesize.
el
And if
inicio,
we
desde el
don't have
diseño de
time,
las
we'll
intervenciones en
continue to
enero,
talk
y lo
tomorrow.
comunicamos
Now, about
públicamente
the
aquí,
Sentinel
más o menos a mitad
surveillance
de la fase
model,
2, consideramos que lo más
we,
importante es
Dr.
la
Alomia and I,
ocupación
we can both
hospitalaria
explain with
y
more details, but
prevenir
as we
que
have
haya
explained,
muertes.
in
Nos
phase
interesa salvar
2,
vidas en
there
la
was a
fase
useful
3, que es la
model. We
etapa
wanted
más
to see what was
retadora
the
al
territorial
respecto.
recognition for
Afortunadamente,
the
las
occurrence for the
predicciones
disease.
matemáticas
In
nos han
phase
permitido
3,
dar un
as we had
seguimiento
anticipated from the
puntual a
beginning,
la epidemia,
with the
día por día, como lo
designing of
acabamos de
our
mostrar
actions
ahora,
to be taken to
y
mitigate,
los
we thought
monitoreos de
that the most
ocupación a
important
través de la
thing
red IRAG
is
nos permiten
occupancy rates and
diariamente
availability
saber que
and to
todavía no hemos
prevent
llegado al
people
punto
from
crítico de
dying. We're
saturación
interested in
del
saving
conjunto de
lives
las
in phase
unidades
3
de salud.
because this is the
Desde luego,
most
como también
challenging
hemos comentado, en
phase.
algunas se saturan, pero
Unfortunately,
existen en
our
respaldo
mathematical
otras. Y el
predictions
modelo
have
Centinela
enabled
no
us
es
to
operativo
follow
por
the
varias
pandemic
razones.
day by
Hemos
day,
mencionado
just like I
algunas,
showed you right now.
nuevamente las retomo. En primer
And
lugar, su
our
capacidad de
monitoring for
resolución
occupancy rates
geográfica, es
from our
decir, la
IRAG
posibilidad de
network
reconocer
enable
estado por
us to see
estado
that we
o
have
ciudad
not
por
reached a
ciudad,
critical point
la
in terms
intensidad
of
de transmisión
occupancy at
no es la
hospitals.
necesaria,
And
porque
as
son
we
muy
have also
poquitas
commented
unidades.
before,
El modelo
sometimes
Centinela
the
opera para el
hospitals are
reconocimiento
full and
nacional
we send people to
y
different
de
ones.
gruesas
The
regiones
Sentinel
donde podemos
surveillance model
reconocer
is not
patrón de transmisión. Pero en
operative.
fase 3
I've said
necesitamos
this a
ser
couple of
mucho más
times, but
precisos
first of all,
porque es
their
donde está ocurriendo
ability,
ciudad
their
por ciudad
capacity to
esta
recognize state
rápida
by state
crecimiento de
or
la curva
city by
epidémica. Lo
city
segundo es la velocidad
how
de
intense the
ocurrencia.
transmission
Los
rate is
casos
there is
confirmados
not
y
really necessary
sospechosos
because
de
there are
COVID
very
se
few
notifican en tiempo
units,
real
hospital
a lo largo de
units.
cada día es
So it's
la
better for
notificación.
us to look at
Pero para hacer
areas
las
where
estimaciones
there
del
are
modelo
more
Centinela
people, where the
se ocupa
population is a higher
los
number of
casos
people,
registrados de
so that we can
infecciones
see what the
respiratorias
transmission rates
genéricas
are.
en 26,000 unidades que
But
tienen
we
un calendario
can see
semanal.
state by
Entonces,
state how
este
quickly
desfase es el que no
transmission
ayuda
is
a tener
happening.
una estimación
And then the
suficientemente
suspect
rápida, no
cases
puede ser en
and
tiempo real, como para
the
que sea
confirmed
útil en esta
cases,
etapa.
we're notified of those in
Un
real
elemento
time.
adicional, un tercer
But in
elemento
order to
que también hemos
estimate
comentado
using the
es, por
Sentinel
diseño de
surveillance
las
system,
intervenciones
we need the
preventivas
cases
con el
that have been
propósito de prevenir
registered for generic respiratory diseases in 6,000 hospitals that have a weekly program. So this doesn't really help us to estimate quickly, because it can't be in real time, how that could be useful in this phase right now. One additional thing there, the third thing, that we have talked about is that because of the design of our preventive measures, which are obviously to prevent contagion, we are saying, please don't go to a consultation with a doctor unless you have really severe symptoms. Because people have respiratory diseases, light diseases, we don't want them going to consultations. That's good news. But in terms of estimating how it affects our estimate, well, the number of consultations go down because people are not going to consultations on their severe respiratory infections. And what was that last one? Yeah. If you like, we'll explain that in detail because that's part of our conventional design. I'm sorry, what was the problem? We haven't made that decision yet. We do have quite a few, we want to consider open dialogue and decide on them. The Swedish model is interesting, but I need more time to talk to you about it. It's 8:00, Blanca. I'm sorry, but tomorrow we'll start with you, Bianca Balades from Milenio. Thank you. Good night.